I think we're all hoping that, the world and Northwell does not experience this pandemic-like circumstance again. However, permanent changes are how we do run things operationally. So we have taken a very much ICS structured report, an incident command system, which is kind of pulled from emergency responses in military, and now we have systems set up that is kind of like a dial. So when we need to dial up, such as load balancing and pandemic, we dial up. When we need to dial back down to normal operations, we dial back down. If the hospital happens to have an evacuation for fire, flooding, etc., we just dial back up. So, thanks to COVID, the silver lining is now we know how to move this seamlessly from a high incident to a low incident on a daily basis.
So at Northwell Health, we have 23 hospitals, we have 76,000 employees, over 700 ambulatory clinics. It's an enormous healthcare system, and we leverage that in the pandemic for patient movement significantly. What we managed to do in the first wave is that we found a way to have our patients, to have the patients who needed to be transferred, needed to be moved out. We essentially made a list on a cloud-based shared list that the receiving hospitals would actually look at that list and they would choose the patients that they would take, which is crowdsourcing. For the second wave, we decided this model isn't the ideal model. The best model is to be proactive. Let's move 5 to 10 patients a day and prevent from getting to the point where we have to move 30 or 40 patients. So we built a whole new model. We actually built software specifically for this.
Is he clammy or having cold sweats?